A taxi driver openly expresses his frustrations to an administration police officer at the parking lot of Kenyatta National Hospital's accident and emergency section, having by now already spent an hour at the hospital's corner, secluded. Minutes later, and the very administration police officer is handed a mask. What speaks of the high alert at the Kenyatta National Hospital Thursday morning, after a 29-year-old woman, Gladys Muthoni, said to be bleeding from her nose, ears and mouth, died on arrival at the hospital, having been rushed here for emergency treatment from her workplace, a hotel in downtown Nairobi. Her body also in isolation inside this taxi, doctors terming the bleeding only as suspicious. Her father, who accompanied her as soon as she developed complications, also isolated and helpless here, together with her cousin, bringing to 3 the number of those isolated and quarantined, together with Gladys Muthoni. This as hospital officials consulting in the other corner of the hospital at first say nothing of the situation in what is seen as a move to contain it. As word went round that it could be hemorrhagic fever, Ebola and Marburg, part of a family of the viruses, a disease with mortality rates of up to 90%, where in most cases the patient bleeds to death. Only such medical equipment telling of the urgency of the 10:20 a.m. incident, time having stood for those isolated, what would see anyone who tried to come into contact with a 3 barred.
There are very many possibilities that could be the cause for this, and some of the things that we worry about are certain what we call viral hemorrhagic fevers, which can cause sudden bleeding, and those are the things that we worry about. But also others. And these other causes usually are not dangerous, are not infectious, and they don't pose any serious public health concern.
Health officials would hours later proceed with a team from the Center for Disease Control, CDC, and Kenya Medical Research Institute, KEMRI, to conduct an investigation to determine the exact cause of death, quarantining, taking samples.
We've chosen to be very open-minded, and what we have chosen to do is to assume the worst. And to assume the worst is to assume that we probably have a disease that is maybe infectious, that may be risky.
Officials are expected to announce the preliminary test results within 24 hours. Until then, they continue to take precautionary measures. Mbilu, Citizen, live at 9.